The People's Health Voice is an opportunity for South Australia to establish a way for people in the community to have their voice heard by the health system.
Hello, my name is Joanne Minks and I'm from a small rural community right down the bottom of the southern Yorke Peninsula, a town called Yorktown.
My name is Kudzai Nyamand. I'm from Mawson Lakes and I'm representing an organisation called Nokutenda Disability Foundation, which is going to be working with SACCOs for the People's Voice.
My name is Jasmine Whitham and I live in Unley and I am a volunteer with the Anti-Poverty Network.
SA Health have actually asked SACCOs to be the organisation that does this work on their behalf, and I think for SACCOs that is because we have great connections with people in the community and we've spent a lot of time making those connections stronger and having all of those people willing to give their time up to come and talk today about what the People's Health Voice will look like.
It is important because my community face a lot of barriers. So for us to address those barriers, we have to engage with organizations like SACCOs so that they can have good access to mental health services and physical health services.
For me to be able to lend a voice to it is an important thing. So people have concerns, but they don't always know how to voice them.
Today's forum brought together people from right across South Australia and from all the different communities that we've been talking to who have these problems with access and responsiveness of the health system to begin to work together to build a new People's Health Voice for South Australia.
I think today was just really exciting, again, that things are going to be changing in the future, that there's an opportunity to uplift the voices of the whole community, but especially groups that are marginalised. It's exciting that those voices are going to be heard and perhaps influence the way that systems are run.
It was very important because I could hear different voices, different people from different organizations. There are challenges that they are facing as well, and I could see the similarities, with issues like stigma and with issues like health inequalities, just to realize that we all share kind of similar challenges.
And then we invited people to put their hand up to be a part of this process of building the People's Health Voice. And we were overwhelmed really with the number of volunteers that are willing to give their time to make a People's Health Voice for South Australia, to contribute in ways that are going to mean we don't just talk about the problems, but we act to try and fix them.
I'm still very keen to be involved and continue on in that community connector type role and being able to follow along with the process and to be able to sort of be that go-between. It's a really important thing in all communities, but particularly because we have to travel such great distances to get to anything or access services.
I think today's event is a fantastic first step in a process that will engage many people across South Australia and led now by the community themselves, working out what needs to be done, who do we need to hear from, and what are we going to do next.
I think, like so often, health services and health networks, they really aim to have community consultation and often do a really good job of that, but nothing's really acted on. So it's really heartening to think that that might change in the future, and we'd really like to participate and be able to share the voices of the people that we're representing.